cost is unsustainable. Maida told you earlier that it's almost 18% of our gross domestic product on a federal level. That's true. It is now 25%. Medicaid is 25% of the state of Illinois' budget. By 2019, it is estimated it will be 50% of the state of Illinois budget. We cannot continue at this rate. We do need some reform. The question is, what is reform? And we ought to ask for the definition of that because it's now getting mixed up with we're going to try and control costs, and we're also going to increase access so that 47 million people allegedly uninsured will have coverage. Now the question is, how can we get healthy in terms of our system if we're losing money at such a rapid rate, but we're going to add another 50 million to it so we can lose it even faster?
And that is that there are only 3 countries in the world that have a fee-for-service medical system like we have here. The United States being one, Singapore being the other to some extent, and South Africa. You remember the first heart transplant, Christian Bernard, was performed in South Africa. There have been very interesting healthcare dynamics in South Africa. So we have something that's been handed to us that is relatively unique. But we really have 2 systems. It's not fair to say we have a healthcare system. Think of it like Siamese twins or conjoined twins. Excuse me? Oh, sorry. We have a private system and a public system. They're similar, yet they certainly have some differences. The public system, Medicare, Medicaid, the VA, things of that nature, your state high-risk pools, about 46% of us are in one of those programs. The rest are in the private side. And a lot of what we're hearing today, coming from Washington, is mixing these 2 things. Why do we have to have some reform? Well, we know that the cost of health insurance is high. Many of us get it through our employer, and some of us are maybe just one pink slip away from losing it. And that's a problem, and we can fix that. I believe we can fix that without burning down the entire house. You know, if you need to remodel the living room, you don't tear down the house to do it. And I hope groups like this will provide some level of focus to those in Washington that are making these type of decisions, to focus these limited resources in that capacity.
So what's really happened since the 60s is that at that time, I was your family doc because I was your family member. And with the insurance industry and Medicare and government regulations, it has done all it could to separate me from you. And that hurts all of us, because as a physician, we are your advocate. We represent you, your interests, your needs, what you want. And the more that the government can do to silence physicians like me, the more you are in harm. And that's been the biggest sin of all that's really happened through all these years. There's a lot of reasons, that our healthcare system struggles, but without a doubt, it is the best because we say no to nobody. We care for everyone. But with that comes a cost. And that's what has to be reformed and looked into. If you look at other industrial nations in the world, why is their cost cheaper? Because ours is very expensive. Because they say no. They have arbitrary ways of deciding who gets what, when, and what will be delivered. Well, frankly speaking, if I let you die, we will save a lot of money. But I don't think anyone wants to do that. So reform must be cognizant of that reality. And your physicians must have the power to represent you and be your advocate. And that's where reform really has to go, to bring us back into your family network and be there for all of you.